Let's talk about genetic carrier screening, autosomal dominant disease, achondroplasia, dwarfism, Huntington's chorea, Marfan's neurofibromatosis, osteogenesis imperfecta, von Willebrand's, autosomal recessive diseases, enzyme disorders, thalassemia, congenital adrenal hyperplasia, cystic fibrosis. This is a C disease, Tay-Sachs, SMA, phenylketonuria. Phenylketonuria is a deficiency in hepatic enzyme phenylalanine hydroxylase, which converts phenylalanine to tyrosine. The fetal brain and heart at risk since phenylalanine crosses the placenta by active transport. There's a 90% risk of developmental delays, 70% risk of microcephaly, and 10% risk of congenital heart defect. Phenylalanine less than 6 milligrams per deciliter at least 3 months prior to conception is recommended. X-linked recessive disorder, Duchenne's, hemophilia, Fragile X, non-Mendelian inheritance, congenital heart lesions, neurotube defects, cleft palate and lip. SMA is a autosomal recessive. All patients should be screened for SMA. It's a deletion in the survival motor neuron gene, SMN1 gene. Incidence is 1 in 6,000 live births, leading genetic cause of infant death. Carrier rate is 1 in 40. There's no effective treatment. Types: type 1 onset is less than 6 months of life, respiratory failure within 2 years. Type 2 is intermediate severity, onset less than 2 years of life, able to sit but unable to walk or stand without help. Respiratory insufficiency, uncommon cause of death. It's a common cause of death, respiratory insufficiency. 80% of SMA are type 1 or type 2. Type 3 is the mild form. Onset is 18 months. Type 4 is adult onset. So type 1, 6 months. Type 2, 2 years. Diagnosis for screening. We have the SMN1 gene and 2 gene. The 1 gene is the active gene. So the detection of SMN1 gene deletion is diagnostic. Carrier screening, quantitative PCR for SMN1 copy number. 95% sensitive, 3% population have it on the same allele and therefore carriers. So they are carriers, but they're unable to be detected using the routine assay. So we have to tell the patient that even if they're negative, there's still a 3 to 5%, let's just say 5% chance they still are a carrier. Cystic fibrosis, also all patients should be screened. Most common life-threatening autosomal recessive condition in non-Hispanic. 4% white and Ashkenazi Jews. Have this disease. One out of 2,500 people in non-Hispanic patients. Most common life-threatening. CFTR on chromosome 7. Chromosome 7. So let me double check. Cystic fibrosis. Dun, dun, dun. Yeah, I don't know what this 4% mean. Here. 1 out of 2,500 non-Hispanic has cystic fibrosis. Still has a chance of being carrier even after screening due to not all frequencies are tested. There are 1,700 mutations identified, but most screening only tests the most common 23. Hemoglobinopathies, 1 out of 10 African American has the SS trait. You will see elevated F and A2 greater than 3.5%. Oh, this is beta thalassemia. You see elevated F and A2 at greater than 3.5 centimeter on electrophoresis. And also for alpha thal DNA based testing is needed. Fragile X, most common inherited form of intellectual disability. Carrier frequency 1 out of 80 with family history of intellectual disability. One out of 250 in the general woman population is a carrier. So if your family has a history of intellectual disability, you have a 1 out of 80% chance of having Fragile X. But in the general population, it's 1 out of 250. Borderline to severe common cause of autism. Distinctive facial features in males, enlarged testes, joint and skin laxity, hypotonia, mitral valve prolapse, delay in speech and gross and fine motor skills. It's X-linked. There's a expansion of repeated segment of DNA, cytosine, guanine, causing methylation of inactivation of FMR1. Less than 200 repeats are pre-mutations. Repeats in female may expand during oogenesis, affecting the child. Carrier screening. Pregnant woman, elevated follicle stimulating hormone or premature ovarian failure, less than 40% of less than 40. A patient with no family history requests If the patient has no family history and they request Fragile X screening, you can screen her. Carrier screening if they're pregnant. Fetal DNA analysis from amniocentesis or CVS for diagnosis of fetal disease. Screening for these genetic conditions in a Jewish descent is recommended by ACOG. Number 1 is Canavan disease, degenerative neurologic disease, mutation in gene for aspartate Patient has macrocephaly, hypotonia, intellectual disability. Treatment is supportive. Patient died in adolescence or earlier. Cystic fibrosis. 1 out of 30 Ashkenazi Jews has. It's a carrier. Familial dysautonomia. Disease of the sensory and autonomic nervous system. Mutation in the familial dysautonomia gene. Abnormal sucking and feeding, episodic vomiting, abnormal sweating, pain and temperature insensitivity, labile blood pressure, carrier rate also 1 out of 30. Tay-Sachs, number 4 is Tay-Sachs, severe progressive neurodegenerative disease, autosomal recessive lysosomal storage disease. GM2 ganglioside accumulate throughout the body, dysfunctional hexoaminidase A, death in early childhood, 1 out of 30 of Ashkenazi Jews. So everybody's 1 out of 30, huh? 1 out of 50 French Canadian descent, 1 out of 300 in non-Jews. Jews and French Canadians should be offered carrier screening, carrier testing, DNA based. Hexoaminidase enzymatic activity testing in serum or leukocyte. False positive rate is high in pregnant or women taking OCPs. Fetal disease with CVS or amnio. Other Jewish carrier screening that can be considered: Bloom syndrome, familial hyperinsulinism, Fanconi anemia, Gaucher's disease, glycogen storage disease type 1, Joubert syndrome, maple syrup urine disease, mucolipidosis type 4, Niemann-Pick, Usher syndrome. But the top 4 is Canavan, cystic fibrosis, familial dysautonomia, and Tay-Sachs. 1 in 30 carrier rate.